It's unprecedented. I don't think any of us could have foreseen ourselves being involved with such a worldwide pandemic, such as the one that we're facing right now. I think we definitely were given warning signs from what we saw take place in China, what we saw take place in Italy. I mean, they have had tremendous casualties from infections or people being infected with coronavirus. I think one of the biggest limitations in the US was really when we learned about these infections in China and in Europe, developing testing capabilities and really expanding the hospital capacity to handle increased patient loads, especially in the intensive care unit. We've known for many years that a virus like this could happen. It's very hard to stop the spread, but we may be able to stop the magnitude of spread with more widespread testing, with the quarantining and social distancing that we've been doing. The approach that the UAE has taken is an excellent approach. I think actually what they're doing in the UAE is a better approach than what I'm seeing being done here in the US for a number of reasons. I really praise and applaud the leadership and the community there for taking all the necessary measures to ensure the safety and the security of the UAE citizens and the residents as well. What the UAE is doing, as far as I know, is basically testing as many people as they can. And by testing as many people as you can, you know who's infected and who's not infected. And when we have that information, we actually can control the spread of the virus even better. In the US, we don't test everybody. We test mainly people who have symptoms, fever, cough, and shortness of breath. And as a physician, I'm really grateful for how seriously this pandemic is being taken, especially in the UAE. I think to have people stay at home and avoid crowded places is really slowing the spread of the disease, of this viral infection. And it's really helping us and our hospitals from being overcrowded and us having to make difficult decisions. I think now that more than ever, what I've seen really is doctors from all over the world come together, countries come from all over the world coming together, working hand in hand, sharing information, providing supplies, giving treatment recommendations, running clinical trials. I think, right now it's not an institutional effort. It's not a individual hospital effort. It's not an individual country's effort. It's a whole worldwide effort that we need to collaborate and coordinate together, regardless of what our beliefs are or regardless of what differences we have. I think right now is the time when we need to work together to help people and to make sure that we can control this virus.